Now there is clear evidence vaccine offer protection against Omicron. That's the word from Dr. Joe Phaahla, the Health Minister. The Minister also says the variant is spreading faster than ever seen before and has already reached all corners of the country. Our reporter Heidi Giokos is on this story and she joins us now live for the latest. Heidi, it is quite clear, obviously, that this Omicron variant is driving the fourth wave. But tell us a bit more about the fact that you being reinfected is high.
Yes, certainly. And I think this was a question on many people's minds to say, well, if I'm vaccinated, is there a chance of me being reinfected, or if I already have had COVID-19 with the other variants, can I get Omicron? The statistics that are coming out, Masego, prove that you can be reinfected. Because Omicron is highly transmissible, the chances of you being reinfected are high, depending on your exposure, of course. So we do know that previously, for example, Delta was highly transmissible, but with Omicron, what they are finding in the data that's coming through, you are likely to infect 2 to 3 people if you have Omicron. So it's highly transmissible, and this is the concern here that the Department of Health has picked up together with the scientists that are trying to analyze the data, that it's highly transmissible and there's a possibility of reinfection. But it's not all doom and gloom, and it's important that we try and find the small silver lining, Masego, in all of this, is that if you are vaccinated, there are chances that you will not fall severely ill with COVID-19, and you will possibly not be hospitalized or die from COVID-19 complications if you are vaccinated. That's the stats that are coming through. So yes, you could be reinfected, but it will be mild infection, and that's the positivity that's coming out of this. There is a concern, though, that people are getting reinfected and it's highly transmissible, but what's putting government at ease is that it's not as severe as the second and the third wave. But let's listen to the Health Minister on this.
In terms of whether prior infection protects you, preliminary evidence suggests that there may be an increased risk of reinfection with this variant. People who have had previous COVID could become infected more easily with this variant as compared to the previous variants of concern. A preprint, not yet peer-reviewed article has been published on the risk of reinfection in South Africa, reporting a 2 to 3 times increase of reinfection. Reinfection is defined as positive test after 90 days have passed from the previous infection. But more information is required and will become available in the next days and weeks in terms of the significance of these reports.
And booster shots, Heidi? I mean, we found out yesterday that children between the ages of 12 and 17 years can go get their booster shots. This is obviously because they only got 1 shot of the Pfizer vaccine. Tell us a bit more about that and what happens to other age groups as well.
Yes, certainly. So some good news coming in yesterday and the day before when SAHPRA announced that it has approved a second Pfizer shot for those between the age of 12 and 17. Previously, it was only 1 Pfizer shot that this age group was getting. The reason for this was because they were worried about heart inflammation if 2 vaccine shots were given, but data proves otherwise. And this is why the medicine regulator has said 2 shots will now be allowed. So this is already happening as of yesterday, Masego. So if those between the ages of 12 and 17 got their first Pfizer shot 42 days ago, they are eligible to get their second Pfizer shot. This is, of course, an attempt to try and provide as much protection, especially for this age group, as we are hearing from the NICD that this age group is also being hospitalized for COVID-19. In terms of the other age groups, so those 60 and above, those were the first, this was the first age group that was being vaccinated back in May, and they've got their second jab around the end of May, beginning of June. They are eligible as of the 28th of December to go for their booster shot. So those between the ages of 12 and 17, this is what you call a primary vaccination because it's 2 vaccines that they are getting, whereas those, the adult population, it's called a booster shot because it's a 3rd shot that will provide more protection than what this age group has already received. So as of the 28th of December, this is when this will start being rolled out. Government saying it's imperative for people to go for their booster shots as it provides more protection, which is, of course, what we need, especially with all these new variants. Let's listen to the Deputy Director General, Dr. Nicholas Crisp, on this.
So Pfizer boosters, maybe just to emphasize that boosters are different from additional doses. We've spoken before about additional doses, and the additional doses are given after 28 days or more to people who are immune compromised, specific conditions that are listed and they're on the website of the department, where the clinician then refers those people to the vaccination program for a third primary dose. Now, this is different. This is where after a longer period of 6 months after the second primary dose, the population is losing some immunity, and there's some quite good evidence that we all do, our antibodies do wane after that period. We may still have cellular immunity, and you're going to hear a more detailed presentation about this later. But we on the SAHPRA, which is our regulator, has now said that they find that it is safe and it is appropriate to provide booster doses 6 months after the second primary dose. Now, for us, that means that the first qualifiers for booster doses in South Africa will be after the 28th of December, because that is 6 months from the time the first people got their second dose.
All right, Heidi, obviously a very important briefing there today, but what else did we find out, especially about hospitalization? Is it as bad as we saw during the third wave when Delta was wreaking havoc?
The good news, Masego, is no. This is a very different kind of picture that's coming out here with regards to the fourth wave. Many would ask why, what's the difference? Vaccinations. This is what is different. During the second and third wave, South Africa was not vaccinating. Even during the third wave, we weren't vaccinating at the pace that we should have been vaccinating, and that's why you saw those 60 and above being hospitalized. During the fourth wave, you've seen those between the ages of 20 to 39 being hospitalized and the 40 plus being hospitalized. The Department of Health and the data that's coming out is attributing this to the fact that it's a population that isn't fully vaccinated as yet, with a lot of them not even having a COVID-19 jab. And what you're also finding, Masego, is that in hospitals, if people are hospitalized with COVID-19, their stay is a lot less compared to what they saw during the third wave. And the need for oxygen and ventilators, not that much during the fourth wave. It's a lot milder. It's not as serious. Of course, they are a little bit concerned. I mean, when you have hospitalization admissions of over 400, which we saw yesterday, that is a concern, especially if this continues. But the good news is it's not as severe. Deaths as well. There hasn't been a substantiated increase in deaths during this fourth wave. But of course, they are monitoring the situation, and it's still early days.